Politics, economy, society.
Do you think Nigeria has the structures and the willpower to embrace accountability in governance, or are we still dancing in circles of talk without change?
We break it all down.
A governor serves 4 years, and the next is that he may be re-elected once. And you know already, most governors begin re-election calculations by the second year in office.
On Let's Talk Nigeria, weekdays at 9 a.m.
Power holders or those in the helm of affairs have deliberately ensured that it doesn't work. So the reason is so that it will favor their intentions that are anti-people.
On Golding 97.5 FM, Yenagoa.
Yes. Good morning. Good morning, Nigeria. Good morning, Bielsa, and good morning, Nigerian Extension. And welcome to Let's Talk Nigeria, the program where we discuss issues that are pertinent to all the concerns of us as Nigerians, talking about socially, economic, also our health, and issues that matters to our health, our communities, and our future. My name is Paul Oblomugbasa. Today we are focusing on something many people take for granted, and that is oral health. Every Thursday we come to you and we bring things that concerns around the corridors of health to make us healthy, because we believe that the healthy people will be a healthy nation, and if they're healthy, everything will be fine. And just recently we had the World Oral Health Day, and with the theme, a happy mouth is a happy mind. And even though World Oral Health Day is marked every March 20th, the importance of caring for our mouths goes far beyond just one day. And we have accepted to that. And we say, okay, we're going to be looking at it in serious dimensions. According to the World Health Organization, oral diseases affect about 3.5 billion, staggering number, 3.5 billion people globally, making them one of the most common health conditions worldwide. Here in Nigeria, many people still suffer from preventable oral conditions like tooth decay and gum disease, often due to lack of awareness, poor habits, or limited access to dental care in itself. So, this morning, to help us understand this better, we're joined by Dr. John Osiholo, Secretary of the Nigerian Dental Association Biostate Chapter. Doc, good morning.
Good morning, sir. Good morning, listeners. I'm glad to be here.
So together, we're going to be unpacking the things that has to do with our health, especially oral health. And here on the show, we make it concerning all about us that we can be better. One more time, this is Let's Talk Nigeria. Doc, let's start with something very important now. What exactly is oral health? Let's just start with it first, because if you were saying it's the World Oral Health Day and all the things, firstly, what is oral health and why should Nigerians take it seriously?
Wow. First and foremost, I'll try to make it simplified. Oral health basically has to do with the health of organs in the mouth. Put just the teeth, the tongue, the buccal mucosa, palate, basically the health of this part of the mouth.
Okay.
That's what oral health is.
And why should Nigerians take it seriously?
Well, like the theme for this year World Oral Health Day is a happy
Mouth.
happy life.
That. The more I saw it, a happy mind, I'm like, okay.
Not mind, sorry.
Happy
Life.
Okay, happy life. Wonderful. Okay, happy mouth, a happy life. That means the mouth and the life.
So you can imagine, I tell people that the mouth will mirror the condition of your body systemically, because almost all systemic condition would have an oral manifestation.
Oh, please. Say it again. Say it again.
Almost all systemic condition of the body would have an oral manifestation. That means from the mouth you will be able to detect if something is not right in the body.
Whoa.
Now, as simple as that, it's I've had cases whereby patient came and just from interacting with the patient, first thing I'll just ask the patient is, come, let's run a diabetic test for you, fasting blood sugar, and then you'll be able to say, patient will now be like, I didn't know.
Just from talking.
Just from talking. The mouth odor. From the mouth odor, you'll be able to detect that this patient's having issues as regarding high blood sugar in the body. You see, and then some other oral manifestation will mirror the systemic condition of the body. So if your mouth is happy, you find out that your whole body will be happy, and then you enjoy a happy life.
So when it comes to that, then what makes a happy mouth? Then before we start going to because what makes a happy mouth, and why do many people only visit the dentist when they feel pain? You know, it's only I have this toothache. Why does it even happen like that?
Well,
what makes a happy mouth? Then why do people, Nigerians, why do Nigerians just wait until they feel pain before they get to the hospital? What's the risk in that?
Well, a happy mouth basically is a healthy mouth. Mouth that has no form of any pathological condition. And then why do Nigeria come? Why do they present to the dental clinic when there is pain? Well, I've done a personal study on that.
Okay.
And at the end of the day, I found out that majority of Nigerians belong to low socio-economic class.
Okay.
They have this notion that they are not sick, so why should they visit the hospital? And the majority of them would also choose other alternative, and coming to the dentist most times is the last resort. So if you take a detailed history of patients that present to the dental clinic, you find out that they've done every other thing.
It's more like the last resort or something.
It's the last resort.
Oh.
So tell you that they've been to the chemist, they've been to the pharmacy, their parents have told them to try
One or two.
So at the end of the day, when none of these things seems to be working, and then almost always they'll tell you that they've not been sleeping for a while. The pain is so excruciating that it has kept them awake for like 2 days, 3 days, even up to a week before they eventually come. And then there's this notion that most people have that when you come to the dentist, he would always take off your teeth, always extract your teeth. So because of that, you hear them, they'll tell you that, there's this person I met who they say you should not go to the dentist, or if you go to the dentist, they could remove your teeth.
Especially, sometimes when they say, that sometimes some persons are chewing and like have, how do you not detect the hole, a hole in the tooth, and like, that if I go there, it's going to extract it and all the different things. I'm sure that's why they are like concerned.
Yes, they'll be like, if you go to meet the dentist, they'll extract your teeth. But what they don't know, or what they fail to realize, is that majority of patients that present to the dental clinic present when water don't pass Gary. So there's really little or nothing we can do but to take off the tooth.
Oh, that means if that come
earlier, we would have been able to carry out some preventive measure.
No wonder, because I was wanting to know, because reports suggest that a high number of Nigerians live with untreated dental issues.
Very true.
Why is this the case?
Well, basically, like I said, in the early stage, it may appear unsymptomatic, no symptoms, or mild symptoms. I'll take for instance, I've seen people, when we get talking and they get to know that I'm a dentist, then the next thing they'll tell me is that I have a hole in my teeth. Okay, you have a hole in your teeth. How come you've not done anything about it? I say, but they pain me.
Oh.
So because they are not in pain, they don't feel that you do anything about it. So at the end of the day, after proper education, you'll not be like, "Ah, if you have a hole in your teeth and it's not paining you, this is the best time to come around so that we can fill the hole." I say, okay, I could come. I could make out time to come. Interestingly, this morning I was chatting with somebody, and I put up a post on my DP, on my WhatsApp DP, and she responded, and then she was asking some funny things.
Okay.
Okay, at the end of the day, and I told her that. Then she now said, okay, I will make out time. No, say I will find time to come to the clinic. And I told her that dental appointment, you don't find time, you make out time to come. There's a difference between finding time to come. That means it's not important. I'll do it when I have the chance.
Yeah.
And you may never have the chance for it because there are different other things that are pressing for your time. They'll tell you, if I don't, even sleep will press for your time. Say, you're not doing anything, you just lie down and sleep. You see. But when you make out time, that means you are putting it at your top priority, and then you come. You see. Now, such a person may not come until when they are in pains. And then by the time they come, there's little or nothing we can do. So the World Oral Health Day, we divide into two major aspects of the activities that we do. One of the things that we do is to create the awareness so that people will begin to take their oral health serious and they'll be conscious of their oral health. And then from time to time, when you go some other places abroad, it's part of your culture to visit the dentist. And just the same way you visit the barber shop to barb your hair, to barb, and you visit your nails for the ladies to make their nails, to make their hair, to do their makeup, to do their facial. That's the same attention you need to give concerning your oral health. Now, what I tell people is that when you come to the clinic and there's nothing wrong, with your teeth, they'll just tell you that there's nothing wrong with your teeth. It's if something is wrong, we'll show you that this is it, this is what is wrong. There's a hole, or you need to clean your teeth, or do you understand? We'll just show you, you will see it. But if there's nothing wrong, we tell you that there's nothing wrong. There are cases whereby some patient even presented to the clinic and said that, doctor, this. And I'll now look at it and I'll tell them that there's nothing wrong. Maybe they took note of a white line, or took note of the fact that their gums are becoming darker. There was one particular interesting case. She came, said that her gums, she's a copper, 7 in Bayelsa, came to the clinic and said that her gums are black. I looked at her gum and I showed her mine. I said, mine is even blacker than yours. And then the next question is that, okay, doctor, what does it mean? And I just told her that it means nothing. And I explained to her that it's just the melanin deposits in your gum. So just the same way we have black complexion or dark complexion people and fair complexion people, that's the same way you have dark gums, and then some other people have.
Okay, so with that one being said, what are the most common oral health problems that we encounter, especially like in Bayelsa?
Okay, in Bayelsa, the most common oral health problem that we encounter, there are two. The one that has to do with the teeth, which is the dental caries, holes in the tooth, holes in the teeth.
As a result of...
if I want to talk about dental caries, I like to simplify it so that everybody will get it. Okay, there are 4 major factors that play a role, 4 major players when it has to do with dental caries. The first one is microorganism, which all of us, we have a lot in our mouth. A lot. And then the second one is residual food substance. Then the particular tooth substance itself. And then all these things take place over a period of time. So the fourth factor is time. So by the time the microorganisms in the mouth act on the residual food substance.
The residual food substance, break it down to the common person so they can understand.
The remnant of food that gets stuck in between your teeth when you eat. So the microorganism act on these remnants, and then it produces some toxic toxic substance,
Okay.
which are acidic in nature. So this toxic substance is what dissolves the tooth substance, and over a period of time, it will bore a hole on the tooth.
Oh.
That's a very simple way of putting it. Now there are places you will go where they'll tell you that there are worms that eat the tooth.
Yeah. Yes.
All those are just
Fabu. Don't mind me. Fabu means lie in Yoruba parlance. We say Fabu.
yeah, all those are just
To sell because you know sometimes we hear those people say they say bongo nishe, they have this one say this thing, say worm will eat your teeth and all these things.
and you'll be amazed the number of people that they are able to, well, I use the word convince
Yeah.
that it works. I'll tell you a very interesting one. I had a friend. She is a PhD holder. She's a pharmacist. A PhD holder. She's a lecturer. And she had tooth issues. So one day she called me, said she was traveling and somebody gave her this. She brought it to me. At the end of the day, and I said, okay, I have some extracted tooth, which I have kept. And I brought it and I added it. And we're waiting for the worm to come out. We are still waiting for the worm to come out of it today. And this same friend, interestingly, now went home to her village and came back. And she brought me one particular leaf. I said, do I know this leaf? That this leaf, she was told that, first and foremost, she's a pharmacist. So the inquisitive, she wanted to know.
Yeah.
So gave me the leaf and I said, no problem, I would do my study and research of the leaf. I never had time to do it. But at the end of the day, how did the story end? A particular tooth that was giving her issue, we had to extract it. And that was how she was able to get her peace. So back to your question.
Yeah.
Common dental problem that present to the clinic here in Bayelsa. Dental caries, that's holes in the teeth. And then number 2, the gum. Gingivitis. And break it down. Gingiva means gum. Anything itis means inflammation. Inflammation of the gum. Very common. And what is the major cause of inflammation of the gum? Poor oral hygiene. So when food substance gets stuck on your teeth over a period of time, it becomes calcified. And this calcified food substance, known as calculus, is a good substrate for microorganisms, for bacteria to thrive. And then before long, it irritates the gum and causes the gum to be inflamed. And then one of the most common symptoms, one of the most common complaint is that I notice that when I'm brushing in the morning, there is blood. So that means the gums are inflamed. And bleeding is one of the cardinal signs of inflammation. There are 5 cardinal signs of inflammation.
Okay. Bleeding is one.
Bleeding is 1.
Okay.
Redness. The gum will appear red.
Okay.
That's 2. Then the third one is that don't really apply to the mouth. It becomes hot. But it doesn't apply to the mouth because, of course, the saliva has a way of cooling.
Yeah.
Okay. Then there's pain. And then the last one is loss of function. Doesn't apply to the mouth.
Okay.
So out of the 5 cardinal signs of inflammation, 3 applies to the oral cavity, applies to the gum. And that's bleeding, redness, and of course, pain. The other 2, heat and loss of function, don't apply to the oral cavity.
Okay, so but how much of this is linked to diet, especially sugar and salt drinks consumption? Because we just munching all these things like that. And also, why are answering that? Also talk to us about mouth odor too as well.
Okay, mouth odor that's a big one. That's a big topic. I'll try to summarize it so that at least we'll get the main thing.
Yeah.
Okay, mouth odor can be divided into different types. But just know the source can be from two sources. Either it's coming from the local factor that's within the mouth, or it's coming from systemics that's within the body.
Okay.
So you find out that if you're having issues with your lungs, it will emit through the mouth. You're having issue with your stomach, maybe a condition like ulcer. If you are dehydrated, that means there's not enough fluid in the body. If you're having issue with high blood sugar, even those that take some alcoholic, those that are alcoholic. Okay. Yeah. So all those can cause systemic halitosis
That's from within.
from within the body. But within the mouth, okay, you talk about poor oral hygiene. You talk about maybe gum infection, or you talk about those that take some spice food like garlic, things like that, and those that smoke. These are all local factors within the mouth. Okay, so mouth odor, source, local factors, systemic factors.
Yeah.
Okay, now where it gets interesting is that there are those category of people that will come to meet you and tell you that they have mouth odor, but they don't have mouth odor, but their mind is playing tricks on them.
How does your mind play tricks on you?
Oh, it happens ever so often. Is it so they will come meet you and tell you that, doctor, I have mouth odor. And then you try to find out, how do you know you have mouth odor? And they'll not tell you that, I notice that anytime I'm talking to somebody, the person is kind of rubbing the nose, or the person tends to look away. And I'm like, okay, the closest person to you, your spouse, your children, what have they said? He said, no, those ones, they love me too much. They will not want to tell me.
Because after all, they say there's a proverb that says, "Now only person will be your friend, but that's your mouth is man."
Yeah. And then they will not be like, no, they are just trying to deceive me. But I know that I have it. Okay. I will not tell such patient that I've been talking to you for a while now and I've not been able to perceive anything. Say, no, doctor, you're just trying to be nice. Now, by the time you find yourself in such situation,
How do you come out from that?
then you know that you're dealing with a mental case.
So that means it's more psychological.
Psychological. And then by the time you probe, you now discover that there is some form of low self-esteem. Maybe the person has just come out from a broken relationship, or person has just lost the job, or is not doing well in school, something like that. So at that point, you know that you are dealing with, and then you have to refer for psychiatric evaluation.
My goodness.
So that's why I say the mouth odor thing, it's a big one. If you go abroad, there are some specialized hospitals that's all they specialize in dealing with.
Really?
Yeah. They are so much involved in managing a patient with halitosis.
Okay, then because what you are saying now, this thing you just mentioned, I just wanted to ask how does oral health affect confidence, mental health, and quality of life?
Well, plays a major role because when you talk to someone, you actually you really will not. When you're talking to somebody, there's what they call verbal communication and non-verbal communication. Okay, so one of the non-verbal communication has to do with your gestures, your hand movement, and your facial expression, and to an extent, it also has to do with the aura that comes with you, both from your fragrance, your perfume, and also from your mouth. So there are some people that you talk to, and then already they've put you off because of maybe because of their presentation, because of their fragrance that come with them, their body perfume, and then because of their mouth odor. You see. So your mouth odor. And I tell people, when you come for cleaning of your teeth, you yourself will know that something has happened. And because you can go through life and just be using your teeth, using your mouth to eat and then brush, eat and brush and eat and brush. But toothbrush itself is limited, so it doesn't remove everything. Then over a while, over a period of time, you find out that by the time this calculus gather this, and then you now come to the clinic and you literally see it coming out from your mouth. And I've had cases whereby they'll ask, this thing, don't be part of my teeth. I'll be like, no, this is your teeth. This is not part of your teeth. I say, hey, all these things stay inside my mouth? I say, yes. And then by the time you're done, the patient will testify to the fact that my mouth feels light. I say, no, doctor, it feels good. I attended to a patient sometime last week. She presented to the clinic and just she had a denture, she had a missing tooth, so she was wearing an appliance, a denture, an artificial tooth.
Okay.
And it was broken, so basically she came to replace the denture. When the process, when I did mouth examination, oral examination, I found out that, madam, you need to clean your teeth. How much? I told her. I said, okay, I will come back later to do it. I said, no, madam, if you have to do it now, do it. And then I now showed her. Now you see this? Do you understand? Okay. She now said, okay, make we do one. So I had to do it myself. And I took out time to be removing everything. And see, another thing there is this. In our own case, I had to tell her that the reason why you have to do it urgently is because it's beginning to affect the supporting tissue of your tooth. So some of our teeth were beginning to be mobile. I was like, it's going to get worse if you don't do something about it now. So let's do something about it now. And she actually yielded to my counsel, and by the time we're done, she kept on saying, doctor, thank you very much. Doctor, thank you very much. Doctor, thank you very much. I said, all these things in my mouth now, I don't know. Thank you very much. Thank you very much. You understand? Because she could feel the relief. She could feel her confidence was boosted up by that simple, singular dental procedure. And she was like, wow. She left. The following day, she came back to pick the appliance, and she was still grateful. I said, doctor, thank you
feeling very
much.
fresh.
Thank you very much. I go drag my husband, come make it come to you too.
Okay, with that, of course, I know that the listeners that have been listening, and they have some questions or anything that want to ask. If you want to ask the doctor right now, the phone lines are open. You can call us up on 0707 747 1522. I will take it again, 0707 747 1522 or 0912-000-1975. Send us a message on WhatsApp to 0912-000-1975, and we'll be reading for you. The phone lines are open already. Let's get to hear the first call. Hello, good morning.
Hello, good morning, sir.
Good morning to you. Good morning. Oh, we lost that. Okay, there's a message on WhatsApp. Just came in. Say, good morning, God FM. Can a toothpaste cause mouth odor? Can it cause mouth odor?
No, toothpaste cannot cause mouth odor. Toothpaste cannot cause mouth odor. It's just like asking if can a detergent that you use to wash clothes, can it cause the cloth to be stained? No, toothpaste can.
Okay, cannot, right?
No.
Okay, let's get to the calls. Hello, good morning.
Hello, morning, Paul and your guest.
Good morning. Good morning.
Thank you. Are you from
Welcome, I.
Well, interesting. I listened keenly, and it was interesting submission. However, most things probably the doc said are then little that was clear about it. I don't think it seems to be out of place. But the only area I want to, clarify, maybe not being on same lane. I think the worm has nothing to do with something that is practiced, but it has to do with the body system. So putting out that teeth and expecting worm to come out of it, that will be possible. because the worm functions with the body system. You understand? So the worm is there. When this food, gets decayed, certainly there is worm. So what he said, I would say seems to be on point, because I would say I had little experience about dental. I'm also a patient who has gone through the process.
Oh, okay.
So all what he said is on track.
Thank you very much, Thank you. Let's get this call. Hello, good morning.
Hello, good morning.
Good morning to you.
Yeah, it's still Moses. I call back.
Okay, Moses.
Yeah, I want to ask the guest. Like me, I have this shaking teeth for some time now. It has been a very long time. It's not painful, but the teeth is just, it's not.
It's not firm.
Yeah?
It is not firm. It's not firm.
Yes, it's not firm.
Okay.
It's just shaking. And sometimes when I try to force it, that's when I feel pain. So I don't know. Maybe I need his number in contact so that I can visit his clinic.
Okay. We'll let you know on that. We'll let you in on that. That is interesting. It is just there. It's not firm. You are going to go and bow it, or you are going to go and shake it.
Well, I think I have an idea of what's going on in his mouth.
Okay.
The tooth is mobile.
Okay.
Shaking. It's mobile.
Mobile means it's shaking. Okay.
And then we have grade 1 mobility, grade 2 mobility, grade 3 mobility. Now, grade 1 mobility is just shaking, but not too much.
Okay.
And then it's not asymptomatic, no symptom. Then there's grade 2 mobility, where it's shaking very well, but no pain. And then there's grade 3 mobility, where it's shaking very, very well, and then there's pain.
Okay. We'll come to that breakdown of the grades. Let's get to the calls. Hello, good morning.
Good morning, sir.
Good morning to you.
Doctor, good morning.
Good morning, sir.
Yes. I think the problem I'm having, I was a footballer.
Okay.
I used to eat chewing gum every time. So, chewing gum to do sports, but now when I stopped chewing this chewing gum, then I come to discover that the whole aim inside this my premolar is paining me. Then later now, somebody directed me, a friend directed me, take Navagin. Just put it on top there. I put Navagin on top there. The way it's paining me, it seems dissolved. And all that is stuff, and I start seeing income. Then my little children are licking sweet every time. Like 3 weeks ago, 1, 2 sweet. When they finish, after he said that they pay me. I said, not be too much sweet when they leave. So I have to stop her. I said, don't live sweet again. Then I sent her for Navagin. And soon as he took that Navagin today, at the moment, the thing just go off. So I'm believing that, and pure water, this ice water also, and see that it's also one of the disadvantages of the mouth. After you will drink pure water, when you get water, you will drink it later. The teeth, after drinking it, is a problem.
Okay.
So I want my doctor to advise me.
Okay.
And advise the world also. I want pure water and sweet.
Okay, sir. Thank you. Please take note of all these things because the lines are really buzzing. We need to take the calls. Hello, good morning. Yes, good morning. Ma, I hear you. Hey, this one.
Morning.
Good morning. Good morning.
I'll call you 3 times now.
I agree.
You know why they call you 3 times? Good morning.
Good morning.
So now come and every child for the life. Where's the string gone bad?
Okay, that's the
It's not
question.
healthy for the mouth.
Okay.
It's not healthy for the mouth.
Okay.
That is the one that have fine, fresh meat. It's not healthy for the mouth. That's what.
Baby child. Okay. Okay. We outside. Don't worry. Just hold on. See, you are saying that they want to now. Okay, let's just attend to these ones now. Let's attend to these ones.
Okay, let's start from the last one. Chewing is not bad.
Okay.
In fact, from time to time, we do ask patients to chew sugar-free chewing gum.
Sugar-free chewing gum.
Orbit chewing gum. Sugar-free chewing gum.
Okay, okay.
Because it helps to exercise your jaw muscles. It also helps to stimulate the saliva to produce. So stimulate the salivary gland to produce saliva.
Okay.
And saliva have a lot of things that it does in the mouth, including cleaning.
But moderation, too much of it.
How
do you know when you have crossed the line of hey, I don't pass?
You see, everything in life, too much of everything is bad.
Bam.
You know, you chew chewing gum morning, afternoon, evening, 24 hours a day, 20 hours you are chewing gum. The only 4 hours you are not chewing is when you are sleeping. You are overworking the teeth. And then I always tell people that once you become an adult, the set of teeth you have in your mouth is to serve you for the rest of your life. So if you don't take care of it and you lose it, it is gone.
True.
So that's it. Ice water doesn't have any effect on the teeth. I tell people when you take very cold water and you feel shocking sensation, it shows that the teeth are alive, not dead. You understand?
Don't worry, because sometimes you just take it. There's this sensation that just goes through your.
That is when you take very cold water. But when there's an issue, is by the time you take room temperature water and you're experiencing the shocking sensation. That is when there is an issue. That's a red flag.
Okay.
And so there's nothing really wrong in drinking cold water, but just know that some people enjoy it, but it can be very uncomfortable.
The one that talked, the person caller that talked about Novocaine and
you see,
please. He said he took it, but then suddenly he's now handed the tradition to his daughter.
Okay, let me put it this way: the nature of a dental pain is such that it waxes and wears. It comes and goes.
Okay.
It comes and it goes. So you can feel the pain for 2 days, then after which it will go. Then it will not come again till after months. You understand? But you see, there is such a thing known as the evil day. And once that evil day comes, no matter what you apply, there will be an issue. Okay, so that's why I tell people that if you're having tooth issue, no matter how minor it is, visit the dentist. Let him assess. And then if it's something serious, we can do something about it. If it's something that is not serious, we will tell you that it's not serious. If it's something that we still need to observe, we'll tell you that we still need to observe it. Then another interesting thing about the first caller, he said that there's worm, but the worm is not in the teeth.
Okay, that was responding to that part where you said you removed and you were waiting for that your colleague and you were not waiting to see there's no case. But I think that is in a side. There's a message now for you.
Okay.
Good morning. Please, almost every night my mouth is filled with saliva while sleeping. What could be the cause and the remedy? King from Azikoro.
Wow. I've gotten a case like that before in my years of practice.
Wow.
And I was trying to observe. So I now asked the patient to come. And then by the time the patient came, I was now trying to find out. And I discovered that, okay, there's a quantity of saliva that is in normal range. Normal range. Some is less, some, but within the range.
Okay.
But by the time it now becomes excessive saliva, in fact, the very first thing that I asked this patient was like, did any dog bite you? I was like, why did they ask that question? I said, because I wanted to find out whether it's this rabies, because that's the only time where you get excessive saliva. But I now discovered that it was within the normal range, a little bit high, but within the normal range.
Okay.
You understand? So, just like there are some people that tend to sweat a lot. There are some people that don't sweat.
Yeah.
Well, there are some of us that by the time the sun comes up, it will be as if we just came out from a shower. So that's it. So what we need to do is first of all to assess the quantity. And then if it's within the normal range, fine, there's nothing we can do about it. But I can't start telling you that, okay, go and take this so drug that will reduce the saliva.
So there has to be,
There have to be a proper assessment.
Okay.
Let's know whether the quantity of saliva that is producing is within the normal range or not.
Okay, let's get back to the calls. Hello, good morning. Hello, good morning.
Morning. Good morning, sir.
Good morning to you, sir. Good morning.
Yes, sir. I just on the radio when they hear this prescription. When they tell the doctor.
Okay, your name first. Your name and where you're calling from.
Two things that I want to know.
Okay. Thank you. I just called the call first. Doctor, go talk to that one. Doctor, please take note of that. Hello, good morning.
Good morning, GFM.
Good morning to you.
Greetings to you, Papa, and greetings to the doctor in the house. God bless you, sir.
Thank you so much, sir.
Yeah, I still remain sir for the Park constituency 1. I have 3 in 1 question, please.
Okay.
1. Which part of the mouth needs more attention when brushing? Is the tongue or the teeth? 2. How many times is more ideal to brush the mouth for the day? And what's my third question? I think this is 2 I remember. Maybe later I can ask the doctor. Just went off my... I attend to these 2 questions, please.
Ungwano, thank you. Well, please.
Okay, let's start with the second caller. Okay, first of all, which part of the mouth is more important, or which part of the mouth do you give attention to when brushing? 2, the teeth, and then the tongue. You have to brush all sides of the teeth, and then you also want to brush the tongue. And there's no need for you to brush the palate, no need to brush under the tongue, just the teeth and the tongue. Those are 2 important places to brush.
Okay.
Then the second question he asked, that is I remember. How many times is ideal to brush?
How many times I did to brush?
Okay, you brush 2 times in a day, in the morning and at night.
In the morning and at night.
Yeah, there's this nursery rhyme. They say you brush in the morning to keep friends, and then you brush in the night to keep your teeth.
Okay, the person that talked about dryness.
Okay, that one is a giveaway. He went further to say all the other symptoms that he's experiencing, and then he concluded by saying that he's a diabetic patient. So for him to be experiencing dry mouth, that means he has some form of dehydration.
Okay.
Do you understand?
Okay.
And then it's like he's complained about swelling legs.
Yes, he said that.
Pepperish leg. And then he said that he has been taking his drug. Now, here is the point. The fact that you've been taking the drugs that was recommended for you maybe last year, and then anytime the drug finish, you just go back to the pharmacy to buy or restock.
Rather than go to...
Yes, to have a reassessment.
Okay.
And then you know what to reduce, that's it. And that's the problem. When you manage this long-term condition, you would have to see you see your doctor from time to time so that he will reassess and give you a new prescription. And then by the time you are coming with a fresh complaint, he will say, okay, fine, because of this, let us withdraw this one, and let us add this one. Do you understand? So that's what it's all about. You manage the condition. So they'll always ask you to go maybe for like 4 weeks and then come back. And then the first question they'll ask you, any new complaint?
Yeah.
So that they'll know what to do. So his problem, and that's why I tell you that the mouth mirrors the body.
You said so at the beginning, yeah.
He's having dehydration from the mouth, which is as a result of something. So you need to deal with the root cause, and then that dehydration, that dryness of the mouth would completely cease.
Okay, so we'll have comments from Facebook. Thank you for your comments. Okiki Edwards says, nice topic this morning. Thank you, Okiki Edwards. We appreciate you so much. Diamond Irogene says, good morning, Golden FM. I always begin my day with Golden FM. All your programs each day are educative and mind relaxing at the same time. You guys are too much. Thank you. Ugochi Ani says, excellent. I so much love this topic. Good morning, Golden FM. Good morning to you. Thank you for those of you that drop your comments on Facebook. And we will be able to sneak in 3 more calls before we go. Numbers to call still remain 0707 747 1522. That is 0707 747 1522 and 0912 you can send a WhatsApp message to that number, and of course we will be taking it for you. Hello, good morning.
Yeah, Doctor, I called back.
Okay, please.
Yeah, I think the third question has resurfaced in my head.
Okay.
it goes like this. They say, which is the best practice? Is it to brush before you eat or to eat before you brush, especially when leaving the house for the days and evenings?
Okay.
It's more advisable. Thank you very much.
Okay. Doc, that conversation, let's just take note of that. Let's get this call. Hello, good morning.
Yeah, good morning.
Yeah, your name and where you're calling us from?
Yeah, this is Igoya calling from Mangopopo.
Okay.
Yeah, I just want to thank you for bringing such a medical programs on radio.
Thank you.
Because these are the things we really need. In fact, I also thank the doctor who actually has come to do justice to this topic. More of these topics are more of medical topics we need to hear.
Okay.
Thank you very much. I appreciate your efforts. Thank you.
Thank you very much. Thank you. Like we said, we promise you, the Gold Standard Radio, we'll do that every Thursday. Health related issues, we'll do that because we know that our bodies need to be fine. Everybody needs to be okay. Hello, good morning.
Hello.
Hello, good morning.
Good morning.
Good morning to you. Your name and where you calling us from?
My name is Excellent. I call from Google.
Oh, yeah, excellent.
I just want to ask you, one, where in the office did, secondly, before you leave, you make me help us give us the number so that we get in contact in case of tomorrow.
Okay. Okay. Thank you. I know that for the sake of for the sake of phone number, I know if you talk about that one because phone number now, so people go begin the flash. We trust, but he will give us his office so that way you can get across. Hello. Good morning.
Hello, morning, follow. I called back.
Oh yeah, sharp. Aye.
Yes, there's something I want to give. I think I've learned something in my secondary days concerning the truth as biology. I said the cold and the hot doesn't go together, didn't go together. And that thing I think I've been teaching or tutoring persons who have been to tissue. So I want the dentist, to affirm it, whether it's right or wrong. That was taught in my secondary days. So the moment you are taking the hot meal or whatever, even if water, whatever,
okay,
you don't instantly take cold one to follow suit.
Okay. I get. Don't worry. I understand that.
I'm on the right track.
Okay.
Interesting.
Example: you just been eating hot starch and manga. Do you not take cold water? Is it like? I hope I get that. I hope I understand.
Well, the truth is that there is no documented research that prove that it is wrong for you to take hot something and immediately take cold something.
Okay.
So no documented research to show so. Okay, now another question that was asked was, when do you brush? Do you brush before breakfast or you brush after breakfast? Well, both of them are correct. Some people believe that you brush before breakfast. Other people believe that you brush after breakfast. They are both correct. Two different school of thought, which are both right.
Okay.
However, the most important one, and that's the one that we tend to neglect, is you brush before you sleep at night. Which is the one that most people don't do. And that one is even more important to preserve your teeth.
Okay.
There's not enough time for me to start explaining. But when you brush at night, if you can imbibe that habit, it will go a long way to help preserve your teeth.
Wonderful. Yeah. Okay. We see how the calls come in. Hello. Good morning.
Morning, sir.
Good morning to you.
Hey, John, you just came me, sir.
Okay, John. Please go ahead, John. From Agema. Okay.
They asked the doctor, I sneeze much, even at the night, afternoon, morning, I sneeze too much. I don't even know what is going on.
Okay.
So I don't even take malaria tablet, they work.
Before you take the malaria tablet, did you go to the hospital? Did you do a test before go to go and take malaria tablet because of self-medication?
Pardon?
Did you just take malaria tablet because you just feel say your body just you sneeze, and you just go take them, or then prescribe them for you? Hello?
Hello.
Okay, just okay. Well, I was asking because I needed to confirm something. Most times we have PhD in self-medication in this Nigeria. Small thing like this, bam, by yourself. You don't run, bam, but also go pharmacy, go get. We're talking about that, but rather it will help you be better. I think this will be the last call for this morning. Hello, good morning.
Good morning, Paul Bansa. Good morning.
Good morning, my man.
Good guest in the house.
Good morning, sir.
Doc, good morning, sir. Please, I want to ask the doctor because earlier this last week on Friday, I lost somebody that close to me. What will be the cost of somebody having a heart problem that, to the extent that the person cannot breathe? The heart was seizing, the breathing was seizing. Sometimes they will press her before they took her to the hospital. Just spent some time and she died. What will lead to that kind of situation, and what is the prevention? And the person started coughing himself after, not because they have even took her to hospital several times. They will, after taking her to hospital, they will bring her from the hospital and the thing will subside. But she later said the drug that they gave her in the hospital was not even working. So I don't really know what will be the cause of having that heart problem and what is the prevention. Thank you. Good morning.
Interesting. Well, it's something that we encounter every day. People believe that you have the answer to everything.
Yeah.
However, just for clarity's sake, I am a dentist.
Yeah.
In other words, I be teeth doctor. Like the other man that was talking about sneezing. The fact that you're sneezing doesn't mean you have malaria. He may just be allergic to something around him, and that is what's causing him to sneeze.
So he needs to just find out.
He needs to see a doctor who would ask plenty questions, take proper history, do some examination, and probably ask for some investigation before arriving at a diagnosis, and then treat accordingly. So it's systematic.
It's a process.
It's a process.
And you have to follow the process. Okay. Well, we have come to the end of this. Interesting how time flies, really. Very, very interesting. But because persons have been calling and saying, how can they get across to you? Because they have questions and they want to come to confirm. What's your office?
Okay. Our office is at Akuns Plaza.
Akuns Plaza?
Yeah, in Mansha, next to Cardamom Printing Press. You can always catch me there. But not just me, there are other doctors everywhere, other dentists everywhere. You can also go Federal Medical Center.
Okay.
There's a dental clinic in Gloryland. There's a dental clinic in Family Care. There's a dental clinic in Toby's Hospital. There's a dental clinic in Detekoke, Government Specialists Hospital.
Okay. So any of those?
Just the most important thing there is this. If you have dental issues, see a dentist.
Okay. Thank you so much. On that note, I want to say thank you so much to Dr. John Osiolo, Secretary of the Nigerian Dental Association, Bayelsa State Chapter, for sharing insights with us this morning. It's a pleasure having you.
Thank you very much for having me.
And I'm sure